last time we talked about the anatomy of sympathetic nervous system. I just want to give you like a brief reminder. Okay, so parasympathetic fibers parasympathetic can originate in four cranial nerves: oculomotor, facial, glossopharyngeal, vagus, or in the sacral region of the spinal cord. They activate systems that are responsible for digestion, urination, and they decrease heart rate, so on and so forth. Anatomically, you can think of them as, vagus, all visceral organs of the thorax and abdominal cavity; sacral nerves, organs of the pelvis; oculomotor, facial, glossopharyngeal, parasympathetic controls of the various organs in the head. Sympathetic originate in the thoracolumbar region from T1 to L2 of the spinal cord. Okay, control everything from head to pelvis, but also it's anatomically related. Sympathetic fibers that originate in the superior part of that region, closer to T1, T2, T3, will control organs of the head, let's say. Okay, sympathetic fibers that originate in the lower parts will control organs of the, say, lower abdomen or pelvis. So far, does that reminder make sense? Another thing, parasympathetic fibers, you have preganglionic and postganglionic fibers in both systems. In parasympathetic, preganglionic are long, postganglionic are short. And ganglia are in the walls of the innervated organs or very, very close to them. In sympathetic system, preganglionic fibers are very short, postganglionic are long, and ganglia, most of them, are in the trunk, sympathetic trunk. Some ganglia are in the periphery, okay, like mesenteric ganglia, celiac ganglia, and so on and so forth. Okay, any questions before we move to adrenal medulla? No. All right. This organ is of great importance, just incredible importance to us. Adrenal medulla. Adrenal, what does that mean? Adrenal. Renal, what does it refer to? Kidneys. Ad. In Russian it means hell, but that's not relevant. Ad means above. Adrenal is above the kidney. You can see adrenal gland right here. Adrenal gland, I don't want to gut those models, okay? But it's pretty much a little pyramid on top of each kidney, right? As you can guess, these glands produce hormones. One of them is called adrenaline. Well, it used to be called this way. Now it is called norepinephrine. Okay. Now, here's another hint on the name. Epinephrine. Epi means, you should know that for anatomy. Epi, above. Okay. Hypo, below. Epi, above. Nephro, in general, play by analogy. Nephro, kidney. Necro is dead. That's nephro. Okay? So above the kidney, epinephron. Does that make sense? So this gland, adrenal gland, consists of two layers. It consists of the cortical layer and medullary layer, cortex and medulla. And this is the piece of knowledge that there are certain concepts that go throughout the course of whole anatomy and physiology. Not only anatomy and physiology, generally, when we refer to structure with two physiologically and anatomically distinct layers, one layer superficial and another layer is deep. We often refer to those organs as having an outer cortex and inner medulla. So adrenal gland definitely has those two layers. What you see here is a primitive rendition of a cross section of adrenal gland. Does that make sense? We don't talk about cortical region here, but this is not going to be on the exam, so you have like a whole picture in your head. Adrenal cortex produces a number of hormones that will include hormones like, you don't have to write it down, we're going to talk about it in AP2. Aldosterone, cortisone, and various androgens. Wait a minute. Androgens that are kind of, they do not replace testosterone, but they kind of a little bit help it. Does that make sense? What we're going to talk about are medullary hormones. There are two of them. Norepinephrine and epinephrine. As a chemist, I should be embarrassed not remembering what the chemical difference between them is. Okay? So here's what happens. You have an adrenal medulla. So preganglionic fiber, in this case, it's sort of an exception in sympathetic system. It's very long. Okay? Can you see the thoracic ganglia here? Okay? So preganglionic fiber goes all the way through thoracic ganglia. It's still preganglionic, okay? And it ends up in the adrenal medulla. So preganglionic fiber should synapse with what? Preganglionic, postganglionic. Now it reaches out all the way to the adrenal medulla. And it does synapse with the cells in the adrenal medulla, which are hormone-releasing cells. Those hormone-releasing cells are essentially postganglionic neurons. Does that make sense? Does that make sense? Before we move on, I want you to tell me what neurons, postganglionic neurons of sympathetic system generally do. What do they release? Neurons. What? Okay, all neurons, what do they release? Neurotransmitters. So postganglionic neurons of sympathetic nervous system will release neurotransmitters. So those hormone-releasing cells in adrenal medulla will release neurotransmitter. Two of them actually. Norepinephrine and epinephrine. Does that make sense to you? Those two neurotransmitters, where are they released? A little hint, they are hormones. So adrenal medulla essentially releases those hormones in the blood. So if you want to make a comparison to the general sympathetic innervation, you know, you can draw something like this. Let me just so think about this. You have preganglionic fiber, right? then you have postganglionic fiber, and then you have organ. Does that make sense? That's for sympathetic system. So in case of adrenal medulla, you still have normal preganglionic fiber. What are going to be postganglionic fibers? Hormone releasing cells. Sometimes they are named differently. Let me tell you how. Sometimes they are called neuroendocrine. And what's going to be the organ that those neuroendocrine cells act upon? The blood. Yep, the blood. Does that make sense? Okay. So with this, let's talk about sympathetic activation. Okay. It leads to, it's a fight or flight reaction. Now you have to understand that fight or flight doesn't directly refer to the decision that you're making. Okay? Think about this. You encounter a danger of any sort. Okay? You have two options. Either fight or run away. Fight or flight. In both cases, it's going to be a considerable physical effort. Does that make sense? So your heart rate gets elevated to increase blood pumping through the muscles. Your bronchioles get dilated. In terms of muscle stimulation or inhibition, what does that mean for smooth muscles of the bronchioles? When something gets dilated, are muscles inhibited or activated? Inhibited. They relax and something dilates, okay? Mouth gets dry, we discussed that. Can you tell me why mouth gets dry? Why the saliva that you produce is less abundant and is more viscous? Do you remember? Say again? So, less blood gets to this, not to the mouth, I'm not spitting blood, to the salivary glands, right? And saliva is produced from, produced, quote unquote, from blood. The fluid that saliva contains, that water, comes from the blood. Does that make sense? So less blood, less water, it's more viscous. Due to the constriction of those blood vessels, you start to sweat. Okay, what is the function of sweating when you are scared? Realistically speaking. Realistically speaking, none. Seriously. Like if David and I are gonna fight, it doesn't matter whether we sweat before we fight or not. Really, nothing. Okay. In historical perspective, what is the importance of sweating? Like when we were like animals millions of years ago. Yes, the smell. We smell as a threat. Does that make sense? Really, it's like you stink and that's supposed to repel. Pupil dilation, better vision. Also, pupil dilation helps to see farther. Obviously, when you're fighting, you don't really care what happens like 1 foot away from your face. You need to spot danger from the distance. Does that make sense? Blood vessels in the viscera constrict. So blood vessels that go to the digestive system constrict. That decreases the activity of digestive system, decreases the absorption of nutrients. That's not your major concern now. Blood vessels that go to the kidneys constrict, so you produce less urine. and blood gets redirected to heart and the muscle. Now that's an interesting part, because vessels in the muscle, they do constrict, but they constrict to the minimal extent. Does that make sense? Bronchioles dilate liver, releases glucose in the blood, and digestion, salivation is inhibited. We used to have a joke in PA classes that when Bruce Banner has fight or flight, turns into the Hulk. When Hulk has fight or flight, turns into Chuck Norris. I don't know what happens to Chuck Norris. I guess he never has that choice, fight or flight. It's always fight. So this is sort of a summary of two systems. Okay? I want to help you with sort of sorting out systematization of these two systems. So, origin. Parasympathetic, it's going to be cranial nerves. Okay? Oculomotor. Now, with cranial nerves, I am not honestly concerned about numbers. I'm not going to ask you which of the following nerves is not a part of, which of the following nerves does not carry parasympathetic fibers, and we'll give you numbers. No, that's not going to be a question. But I'm asking which of the following nerves carries parasympathetic fibers. Now we'll give you, say, optic, oculomotor, trigeminal, and accessory. And you have to pick one, which is oculomotor. Does that make sense? So I want you to know the names rather than numbers. In terms of the spinal cord origin, it's a sacral part. Okay? Sympathetic, thoracolumbar. Ganglia, where they are located. In case of parasympathetic, in the walls of the organs or very close to them. In case of sympathetic, mostly sympathetic trunk, also some are in the periphery. That makes sense? Parasympathetic, long pre, short post. Sympathetic, the opposite. Remicommunicantis, only in sympathetic. Branching, extensive in sympathetic. Functional role. Please understand which systems are activated and which systems are inhibited. You will have questions like that. Activation of sympathetic system, do blah 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 blah. You have 4 answers, you pick one. Make sense? Activation of parasympathetic system does not blah 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 blah. You pick one. Do I make sense? Okay? I know my exam. I sent it to printing yesterday. I know the questions. Neurotransmitters. With this, we're going to take a little... We're not going to talk about this yet, because we're going to talk about neurotransmitters and receptors just now. Can we move on? Any questions about anatomical part, sort of? Well, not just now, I tricked you. Visceral reflexes. What can be effectors of the visceral reflex? Visceral reflex. What can be an effector of a visceral reflex? Okay, let's start with this. What are 2 types of effectors of nervous system? Muscles and glands. Keeping that in mind, what are, more broad than just heart, what can be an effector of a visceral reflex? Cardiac muscle. What else? Smooth muscle. What else? There you go. Does that make sense? Cardiac muscle, smooth muscle, and gland. Does that make sense? Any sort of gland. Because for somatic reflex, it is always skeletal muscle. We good? Now, there are many visceral reflexes. A lot. This is another fundamental concept that you must know now. I'm dead serious. People get to AP2, which I don't want to scare you, but AP2 is less anatomically heavy, much more physiology heavy. Some of you, I don't know, if you've heard it from other people, may actually say this. Yeah, I've heard that. Okay? So in AP2, certain concepts that we have covered in AP1, they become like every day we use them. Visceral reflex is one of the concepts. If you are comfortable with that sequence of events, understanding baroreceptor reflexes, myogenic response in the arteries, myogenic regulation of renal blood flow, reflexes that regulate contraction of the smooth muscles in the digestive system, vagovagal reflex in the stomach. I can go on and on and on. Becomes, honestly, just fill out the blank. What is the sensation? What is the effector? What is the sensation? What is the effector? Does that make sense? So you have some kind of visceral sensation. Okay? That visceral sensation is sensed by what? What is the first step of sensory system, the lowest level? Receptor. Yeah, some kind of a receptor. What types of receptors do you know? Okay, mechanical receptor. No, I'm not talking ionotropic. That's different receptor. You're right, but that's different. That's receptor for the molecule. This is more broad. So mechanoreceptor. What else? Not in the visceral, because it's not about position. Position is somatic system. Think about this for a second. All of you, think about this. Because position is skeletal muscle thing that relates to our movement activity. Okay? Can be mechanoreceptor, stretch. What else? Huh? Can be, yes. It can be thermoreceptor. Hypothalamus can do that. Not in viscera. You don't have real electrical activity. What type of activity, what type of changes do you encounter, especially in the digestive system? Chemoreceptors. Shitload of chemoreceptors all over the place. Circulatory system and digestive system. A bunch of chemoreceptors. That makes sense? In fact, most of those receptors in viscera are going to be mechano and chemo. Do I make sense? Okay? So you've got sensation. This sensory input goes through the visceral sensory neuron, which has its body in the dorsal root ganglia through the dorsal root of the spinal cord. Okay? And then there is a synapse. Okay? That make sense? And then there's a motor response, right? So we've got receptor, visceral sensory neuron, integration center. Okay? Does that make sense? Some kind of integration. And then there is a motor output. Now you see there is a very fundamental difference. How many neurons, how many motor neurons are there? Huh? Look closer. 2. Preganglionic and postganglionic, right? How many motor neurons in the somatic reflex arch? Just 1. Remember we talked about somatic reflex arch? There is a sensory neuron that goes to the spinal cord. And then there's lower motor neuron that goes from the spinal cord to the muscle, period. So there are no exceptions. Visceral reflex arch always have 2 neurons. Do I make sense? Awesome. Can you control these reflexes voluntarily? Visceral reflexes. You cannot. So one of the great examples is baroreceptor reflex. Blood pressure drops. Okay. When it drops, what happens to the stretch of the arteries? They don't, stretch decreases, they don't yet constrict. Stretch, pressure in the arteries decreases. What type of stimulus that is? Electrical, chemical, mechanical? Stretch. Mechanical. So there are stretch receptors, mechanoreceptors, here in aortic arch. Okay? There are other receptors in the wall of carotid artery, so-called in carotid sinuses. When they sense the reduced pressure, they send signals into the cardiac center in the medulla. How can you compensate for dropping pressure? Increase heart rate, so cardio acceleratory center increases heart rate. Does that make sense? What else can you do? With blood vessels, huh? How it decreases? So compensate for it? Well, blood pressure is low. What can you do to increase it? Increase heart rate, right? I don't understand. Sorry. No. What do you mean by how? Yes. Okay. Blood pressure is low. Oh, how does it know that blood pressure? There are 2 receptors here in the aortic arch and in the carotid sinuses. When blood pressure is low, the pressure on the walls of the arteries goes down. Does that make sense? Listen, James, does that make sense? When pressure goes down, there is less mechanical stimulus on those receptors. Less stimulus, frequency of action potentials goes down. Lower frequency signals to the brain stem. Pressure is down, we need to do something. The response from brain stem, from the medulla, is higher higher heart rate. Number 1. Sympathetic fibers. Okay? Vasoconstriction, sympathetic fibers. And at the same time, signaling to the medulla, which releases epinephrine and norepinephrine, just overall increases like stimulation of the heart and blood vessels. Does that make sense better? Now, you tell me, what happens if the blood pressure is high? What happens to the stretch in the carotid sinuses and aortic arch? Blood pressure is high. Stretch is increased. What happens to the frequency of action potentials that come from those receptors? It's increased. What happens in the medulla? What types of signals does it send out? To lower the heart rate via inhibiting which branch? To lower the heart, you have to inhibit sympathetic and stimulate parasympathetic. What happens to the blood vessels? They dilate via inhibiting the sympathetic system. Does that make sense? It's a classic example of visceral reflex. There's another great example which is very simple. When rectum is full, it stretches. You know where rectum is, right? No, I'm seriously asking. We didn't talk about digestive. When rectum is full with feces, it stretches. That's mechanical stimulation. That stimulus goes into the spinal cord, lower spinal cord. And the more output leads to the relaxation of the internal anal sphincter. Okay? Now, if you are a 3-month-old, what's going to happen next? Defecation, yes. Now, if you're an adult, hopefully, the signal is consciously perceived in the cortex. So you know that you should go, but you have an external anal sphincter, which you control voluntarily. Does that make sense? That's defecation reflex. Micturition reflex, the peeing part, goes the same way. You know, but you have two sphincters, one involuntary, which relaxes once the bladder is full, and one voluntary, which you keep tight. Speaking of which, bladder may explode. So in terms of, kind of summarize, it has same components. Sensory receptor, sensory fibers, integration center, motor fibers, and effector. But what is different? 2 motor neurons, and what else is different? Fundamentally, types of effectors. It's never skeletal muscle. Does that make sense? Okay. Now, efferent and afferent fibers of autonomic nervous system often run together. That makes sense? That's pretty much it. So I have glossopharyngeal nerve, for instance. Sensory fibers, from glossopharyngeal nerve will sense the pressure here. In the carotid sinuses, they will send this info to medulla. And medulla will send partially through glossopharyngeal nerve. It will send the output to the heart. Good? We got it? Any questions? Neurotransmitters. This requires a lot of attention on your side. Okay? So first, let's talk about parasympathetic system. All fibers of parasympathetic system produce acetylcholine. Okay? Now, you ready for sympathetic? In sympathetic system, most fibers have preganglionic neurons producing acetylcholine and postganglionic neurons producing norepinephrine. Some fibers in sympathetic nervous system have both of them producing ACH. That's the ones that innervate the skin structures. Skin blood vessels, sweat glands, erector pili muscles. Does that make sense? Some produce dopamine instead of norepinephrine. Don't worry about dopaminergic. Okay? So far, does that make sense? Now, fibers that produce ACH, that release ACH, are called cholinergic. fibers that release norepinephrine are called adrenergic. You with me on that? Awesome. So we can say that all preganglionic neurons, all of them are cholinergic. Do you see that? All preganglionic neurons are cholinergic. Postganglionic neurons of parasympathetic nervous system are cholinergic as well. Most postganglionic neurons of sympathetic nervous system are adrenergic. A little portion of postganglionic neurons of sympathetic nervous system that innervates skin structures is cholinergic. That's all you got to know. Well, adrenal medulla, neuroendocrine cells produce epinephrine, norepinephrine. So neuroendocrine cells technically also adrenergic. You must know this. We're going to recite it when we're going to talk about receptors more and more. So far, do you understand what cholinergic and adrenergic is? Because if you decide to come to me during the exam and ask me that, I'm not going to tell you. Okay? You have to know what it means. Are we clear? Terrific. Now, we need to talk about receptors. Why? These neurotransmitters, when they are released from a neuron into the synaptic cleft, what do they bind to? Receptor. That's why we need to talk about receptors. Okay? So let's talk about receptors for acetylcholine first. Alright? So acetylcholine will activate two types of receptors, nicotinic and muscarinic. Okay? That make sense? So you can see here, ACH will activate muscarinic and will activate nicotinic receptors. Good? Nicotinic receptors are on the postganglionic neurons of both systems. So let's try, and how am I supposed to insert? Okay, let's try and draw it together. Okay, we're going to draw it step by step. So we're going to have sympathetic and parasympathetic. Awesome. I have an option of color. So preganglionic fibers of sympathetic nervous system are going to be what? Cholinergic or adrenergic? Sympathetic. What do they produce? Yes, acetylcholine. Are they long or short? No, they're short. The preganglionic are short. In parasympathetic, what do they produce? Yes, are they long or short? Does that make sense? Now let's go back. What do they, okay, so let's write down, they both produce ACH. Okay. Now, postganglionic fibers in sympathetic nervous system what are they? Adrenergic or cholinergic? Generally, most of them, adrenergic. Okay? In parasympathetic system, cholinergic. And then there's going to be an organ. Okay? Now, this, let's write down, by the way, let's write down the, so there's going to be norepinephrine, and this is going to be acetylcholine, right? That make sense? We're good? Now, what types of receptors we're going to find on those neurons? So we just mentioned that nicotinic receptors are going to be on all postganglionic neurons of both systems. Does that make sense? Okay, nicotinic receptors. Muscarinic receptors, on the other hand, will be on all cells stimulated by postganglionic cholinergic neurons, which means muscarinic receptors will be stimulated mainly by what branch of the autonomic nervous system if they're stimulated by ACH? Parasympathetic, yes. That's muscarinic. Do you follow me? Now, what about adrenergic receptors? So adrenergic receptors, there are two major types, alpha and beta. Okay, they both can be fairly equally excited by epinephrine. Norepinephrine excites mainly alpha. Beta as well, but just less. So, where are they going to, which system will activate adrenergic receptors? Sympathetic. I'm running out of colors. Does that make sense? Let's do the legend. N stands for nicotinic, M for muscarinic. Adrenergic is self-explanatory. ACH. Acetylcholine, and E, norepi. Does that make sense? Good? Now, my general suggestion, if you can draw that, it'll help you a lot on the exam. We got it? Awesome. What will determine the effects of a particular neurotransmitter on the organ? If the organ has no, hypothetically, muscarinic receptors, will the parasympathetic system have any effect on it? No muscarinic receptors. No, right? ACH may be released, but if there are no muscarinic receptors, there will be no effect. Does that make sense? Terrific. Now, what about sympathetic stimulation? What will determine the effects of sympathetic stimulation? Which adrenergic receptors are there? No, those are neurotransmitters, alpha and beta. Whether you have more alpha, whether you have more beta. Does that make sense? So that will determine the effects of norepinephrine and epinephrine on the specific organ. For instance, norepinephrine stimulates beta 1 receptors on the heart and excites it. Okay? Heart will contract faster and stronger. On the bronchioles, it's going to be beta 3 type. This time, epinephrine, when it interacts with beta 3, it will inhibit bronchioles. Relaxation. Does that make sense? Now, when preganglionic fibers of sympathetic nervous system send the signal, to adrenal medulla, neuroendocrine cells of adrenal medulla will produce epinephrine and norepinephrine. Remind me again, these chemicals, where do they go, these hormones? In the blood. This time it's about 80% of epinephrine and 20% of norepinephrine. The effects of that release will be pretty much the same as the effects of regular nervous sympathetic stimulation. The major difference is how long this effect stays on. Is it going to be longer? When the neurotransmitters, which they are released in the blood. The effect of release of epinephrine and norepinephrine in the blood compared to the effects of norepinephrine in the synapse. Which effect is going to last longer? The blood-mediated or synapse-mediated? What do you think? The blood, why? What happens to the neurotransmitter after it bound to the receptor? Reuptake, degradation, diffusion away. In case of norepinephrine, there's pretty much no degradation. There's a lot of reuptake. Is it relatively fast? Relatively. What about trying to get something out of the blood? Takes a lot of time. So the effect is going to be A, systemic, B, long. Does that make sense? Think about this. When you experience some sort of an immediate stress, I don't know, you being attacked by something, or you are in the dangerous situation on the road, your heart starts to race, right? You have like a surge of the blood, they have blood pressure elevates, all that kind of stuff. And then when everything is away, everything is past, all those threats, does it immediately go back to normal? No, you stay excited for some time. Does that make sense? That's epinephrine, norepinephrine still circulating in your blood. Okay? So, this picture, it's still on video, it's all there. This picture, you have, not you have to, I personally, I'm not going to check every person in this class if you can draw this picture properly, but it's really a good idea to be able to. It'll help you a lot. Okay? Make sense? Now, here are the effects of binding. So, nicotinic receptors. Which branch of autonomic nervous system has nicotinic receptors? Both. So pretty much nicotine or ACH will stimulate both systems at the same time. Does that make sense? Muscarinic are only in stimulated by parasympathetic, right? Okay. So most cases it's going to be excitation, like digestive, urinary tract, and so on and so forth. It's going to be inhibition in case of the heart. That make sense? If you think about this, even respiratory system, when you sit on the couch relaxed, your heart rate goes down, your bronchioles constrict. You don't need to breathe that hard. So it stimulates the smooth muscles. Okay. Adrenergic is, in my opinion, much more exciting. So beta 1 receptor, mostly in the heart. Increases heart rate, contraction force. We didn't learn about renin yet. Renin increases the blood pressure. Beta 2, lungs. Now beta 2 will have inhibitory effect. Okay, relaxes bronchioles, relaxes smooth muscle of digestive system, relaxes smooth muscles of the urinary visceral organs. So if the muscles of the bladder are relaxed, you're not going to expel the urine. Does that make sense? Awesome. If smooth muscles of the bronchioles are relaxed, you're going to have dilation of the bronchioles. You're going to have more respiration going on. Does that make sense? Sorry. If you have blood vessels relaxed and they are dilated, what's going to happen to the blood flow to the organs, especially muscles? It's going to increase. Of course, if they dilated, they become wider. Does that make sense? Beta 3 will stimulate the lipolysis. Why do we want to stimulate lipolysis when we are excited? Huh? Oh, come on. Burning fat is the aim of the modern society, you know, all the body positive image and all that crap. No, seriously, from physiological standpoint, why do you want to burn the fat? To get energy, if you want to fight something. Does that make sense? Alpha 1, constriction of the blood vessels that go to the visceral organs, okay, and also sphincters of the visceral organs. And alpha 2 inhibits insulin. That's a very interesting thing. What does insulin do? How? How does it regulate blood sugar? Does it decrease it or increase it? Insulin. Decrease it. Okay? If you are excited, why do you need to increase the blood sugar? For more energy, yes, for more availability, right? So it will decrease insulin. And also, alpha 2 receptors, binding of norepinephrine or epinephrine to them, will stimulate blood clotting. Why stimulating blood clotting? Yep, if you get injured, so the blood can plug the hole. Do we make sense? Awesome. Next, we're going to talk about drugs. I mean, medical drugs. Don't get too excited. First, nicotinic agents. They will bind to nicotinic receptors on all postganglionic neurons and will stimulate them. So it's pretty much like nicotine. It binds to the nicotinic receptors. Which systems, which responses does it stimulate? Don't look there, it's not written there. Will it stimulate parasympathetic responses? Yes. Will it stimulate parasympathetic? Whatever. Will it stimulate both? Yes. Why sympathetic will dominate? Why would sympathetic dominate over parasympathetic? It's not anatomical. There are two reasons. How is ACH removed from synaptic cleft? Mostly. Out of those 3 ways. That's norepinephrine, reuptake. What about ACH? Yes, acetylcholinesterase will degrade it really quickly. Reuptake takes longer, so norepinephrine stays longer. That's number 1. Number 2, there's a magic organ in the sympathetic nervous system that exerts systemic effects, which is right above the kidneys. Adrenal gland. Adrenal medulla will release hormones in the blood. It takes a while to take them out. Does that make sense? So parasympathetic effects will be local. Sympathetic will be all over the place and long-lasting, so usually sympathetic dominate. You can get nicotine, well, they, politically correct, they don't write that you can get nicotine from cigarettes, but any type of nicotine source will lead to the increased blood pressure and increased cardiac activity, whether it's a patch or it's a cigarette. Does that make sense? Now, we're going to introduce 2 terms, lytic and mimetic. Lytic decreases activity of a receptor. Mimetic binds to the receptor and increases the activity. Does that make sense? I have absolutely zero analogies to it. I can try to make a little drawing here. So imagine there is a receptor. Okay? And there is some kind of signaling that goes down from that receptor. Receptor obviously in the membrane. Okay? Does that make sense? Do you follow me? If it binds mimetic, what's going to happen to that signaling activity down there? It's going to increase. Do you understand the origin of the word mimetic? Mimicry. It mimics the actual ligand for receptor. Okay? Let's say this is a receptor. Anything that binds to the receptor we can call a ligand. So mimetic, some blah 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 mimetic, mimics the normal ligand. Does that make sense? Lytic, what does it do to the signaling down the road? Decreases it. Does that make sense? In terms of the autonomic nervous system, you may have parasympathomimetic, parasympatholytic, sympathomimetic, sympatholytic. Before we move on, just to make sure that you understand the meaning of those words, parasympathomimetic will increase the activity of, in what system? Parasympathomimetic will increase the parasympathetic activity. Parasympatholytic will decrease parasympathetic activity. Sympatholytic will decrease, speak up, decrease the sympathetic activity, and sympathomimetic increase the sympathetic activity. Does that make sense? Now, I will disclose one thing. You will have the question about these interactions, okay? If you want to increase parasympathetic activity, you should use blah, 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 blah. Does that make sense? So, parasympathomimetic agents. Which receptor do you need to stimulate to selectively increase parasympathetic activity? Which receptor do you need to stimulate to selectively increase parasympathetic activity? Which receptor? There are two for them. Which receptor? There's nicotinic and muscarinic. Which? Nicotinic is on both. So you need to stimulate muscarinic. Mimetic or lytic. If you want to be selective, if you want to be specific, you need muscarinic ligands. Does that make sense? Drugs like pilocarpine and bethanechol will increase parasympathetic activity. Pilocarpine is used to treat glaucoma. Do you know what glaucoma is? Except that it's eye, so pretty much it's accumulation of fluid in the eye. It elevates intraocular pressure and impairs vision and may lead to blindness. To increase drainage of that fluid, pilocarpine is used. Bethanechol is used bladder contraction. When people can experience bladder contraction? Difficulty urinating. Increased retention of urine. It can lead to that. Huh? That's one. Although stimulating, here's what I'm saying is when bladder doesn't contract, it can flow out, but bladder doesn't stimulate. Spinal cord damage, number one. Spinal cord, spinal nerve damage. Second, general anesthesia. Sometimes it has to be given to people who just went out of the general anesthesia and there's some kind of impairment to the signaling, which is transient, but patient cannot wait because bladder can burst. So you have to stimulate the contraction. Does that make sense? So essentially, parasympathomimetics, those two, they mimic effects of acetylcholine. Does that make sense? Another interesting type of a drug, which is not essentially mimetic or lytic, but it also increases the parasympathetic activity, are inhibitors of acetylcholinesterase. What does it do, acetylcholinesterase? Acetylcholinesterase breaks down acetylcholine. If you inhibit it, what's going to happen? Acetylcholine is going to build up in synaptic clefts. What's going to happen? Can we be more specific? What effects we're going to observe? Stimulation of which branches of autonomic system? If acetylcholine builds up in a cleft. What about sympathetic? Yeah, so both of them. Imagine two branches of autonomic system going totally haywire. Just like completely, just nuts. Okay? Remember we talked about sludge syndrome? Salivating, lacrimating, urinating, defecating, gastrointestinal cramps, and emesis. Symptoms of organophosphate poisoning. That's the effects of acetylcholinesterase inhibitors. They use this as the drug. So like neostigmine is used to treat disease called myasthenia gravis, but it's skeletal muscles. Now, sympathomimetic and sympatholytic. Here's the thing. Sympathetic system has more systemic effects. So usually the drugs are targeted at the sympathetic regulation because it has much more pronounced effect on the patient. Do I make sense with this? You want to affect something big, something important. Does that make sense? So sympathomimetic target adrenergic receptors. Two that you know, albuterol, okay? It binds to the B2 receptors on the lungs, well, not on the lungs, on the bronchioles of the lung, and inhibits the muscles. Because stimulation of beta-2 receptors leads to the muscle inhibition. When smooth muscles of the bronchioles are inhibited, what happens to the bronchioles? When smooth muscles are inhibited, they dilate. Everybody who has asthma or has a child who has asthma knows exactly how it works. Okay. Phenylephrine. Everybody who took entire runny nose drug at least once knows what it is. Next time you take like cold and flu medicine, read the ingredients. Phenylephrine is going to be there. Go ahead. Acetylcholinesterase inhibitor, yes. It will, go ahead.
The effects of it seem to much stronger than just the vomiting.
Are you talking about used when? Recently or recently? From the standpoint of symptoms, there was nothing like sarin. Whatever claimed to be a chemical attack did not look like organophosphate poisoning by any means. It seemed like totally different. Like that widespread claim that sarin was used. I'm not trying to take sides and say, you know, it was this side of the conflict or that side of the conflict. What I'm trying to say is that the claim that was promulgated by the media and by the politicians that it was sarin that was used to poison whatever, how many people in that village, it did not look like organophosphates by any means. What it was, I have no idea, but I am convinced that it was not organophosphate poisoning. Okay? And resuscitation methods were not at all, you know, not a lot, they were not matching organophosphate poisoning. Because you have atropine, you stick atropine and you help people. Just block the receptors, the ACH receptors. Instead, they were doing some stupid shit there. Sympatholytic agents. Now, sympatholytic agents block adrenergic receptors. Okay? And the agent that you may have heard about is called propranolol. They're called beta blockers. Okay? They bind to the beta-1 receptors on the heart and decrease the cardiac activity. That's it. Pretty simple. Effects. So there are certain things that I wanted to highlight in terms of the effects. What I want to tell you about the effects is you have to be pretty comfortable, and you probably you will by now be pretty comfortable in the effects on the big organs, right? Like cardiac activity. Sympathetic system increases it, frequency and strength of contraction. Parasympathetic decreases frequency. There's no effect on the strength, by the way. Digestive, increased motility, decreased motility, right? Does that make sense? Urinary bladder, increased urination in case of parasympathetic. Okay? Inhibition of voiding. Lungs, constriction of bronchioles, dilation of bronchioles. Does that make sense? Now, a little bit smaller structures. Eye. Parasympathetic constricts the pupil, sympathetic dilates the pupil. When you read and are relaxed, your pupils are constricted. When you run away from something, your pupils are dilated. Okay? Secretions in the head, stimulated by parasympathetic, inhibited by sympathetic. Now, there are certain things that are stimulated only by sympathetic nervous system. Sorry, not salivary glands, sweat glands, adrenal medulla, erector pili muscles. Only sympathetic. Does that make sense? I'm going to go back to previous slide to talk about something else. Okay, talked about digestive. Okay, liver. Think about this. In liver, sympathetic nervous system stimulates the release of glucose. Parasympathetic increases glucose uptake. When you just ate, what happens to the glucose levels in the blood? They go up. Liver takes it in and converts it to the glycogen or to fat, triglycerides. Make sense? Gallbladder is excited because it's a component of digestive system by parasympathetic. Kidneys. Only sympathetic system stimulates release of renin to increase blood pressure. We'll talk about the effects on the reproductive system. Just skip on that. By now, blood vessels are mostly under sympathetic control, and then fat, cellular metabolism, and blood coagulation under sympathetic control. Because honestly, you do not have to. I cannot imagine any situation in normal, like natural life, when you have to decrease your basal metabolism, when you have to decrease the coagulation rate. Does that make sense? You can only increase it to protect yourself from blood loss. You increase metabolism to run away from something. Okay, so understand the effects. I want to specifically stress out, know the unique roles for sympathetic system. Lipolysis, increased cellular metabolism, kidney stimulation, increased coagulation, increased sweating, vasodilation of blood vessels in skin, elevation of hair. That makes sense? Now, while we're at it, I want to talk about the tone. Tone in physiology means that there is... Questions? Paige? Question? Yes. For smooth muscle, it's relaxation. Exactly. When gallbladder is excited, it contracts and releases bile. Did I answer? Awesome. Sure. Don't hesitate to ask me even from like the back of the class. Tone. Imagine the blood vessel. Blood vessel is under sympathetic control and it has certain sympathetic tone, which means normally, right now, when you're sitting in your chairs and you're fairly relaxed, your blood vessels are partially contracted. Listen carefully. Partially contracted. What it means? Sympathetic activity is not zero. If you need to dilate the vessel, what would you do with sympathetic activity? You will decrease it and it will dilate. If you want to constrict the vessel from the baseline, what will you do with the sympathetic activity? Decrease it. Does that make sense? You can think of it this way. I'm not going to switch now. So that's maximum sympathetic activity. That's minimum sympathetic activity. That's your blood vessel. Does that make sense? So if you want to contract it, what you're going to do? You're going to increase the sympathetic activity, right? It's going to be contraction. Does that make sense? That's going to be dilation. We're clear? You see what I'm saying? You have to understand the idea of the tone. Now, sympathetic tone will dominate in the blood vessels. Parasympathetic tone, surprisingly, heart and digestive system. Think about the heart. Heart is constantly under parasympathetic control. What does parasympathetic system do to the heart? Slows it down. So your heart is constantly on the brakes. If you need to increase the heart rate, what would you do first? It's constantly on the brakes. You will release the brakes, right? So first, you decrease the sympathetic stimulation and heart rate goes up. Does that make sense? And then you can kick in sympathetic. So the existence of the tone often allows you to broaden the regulatory range and to make sure that transition from, say, low activity to high activity is smooth. Make sense? Tone? Oh yeah. So heart is under parasympathetic tone, which means it is constantly controlled by parasympathetic. It receives inputs from parasympathetic system all the time. Think about this. Imagine this, you drive the car and somehow you press the accelerator, it's on the cruise control, okay? I don't know how it happens, but you cannot imagine. But imagine you drive a car, but you hold your foot on the brake all the time. It goes at a certain speed. And then if you want to increase the speed, you just lift your foot off the brake. And it goes faster. In case of the heart, your heart is always on the brake, normally at the baseline. And that brake is your parasympathetic stimulation. If you just remove parasympathetic stimulation, your heart will start to beat faster. Does it make sense? That's the idea of the tone. Everybody's comfortable with it or not? That was the question. It wasn't a statement. Norepinephrine versus epinephrine. That's actually a pretty exciting story. Norepinephrine. Constriction of all blood vessels. Increased cardiac activity. Dilation of the pupils. Epinephrine has the same effects, but there are a few things that are different. It stimulates heart even more. It does not constrict blood vessels of the muscle, and it has very high metabolic effect. Now imagine that you need to start exercising. Do some sort of a heavy physical activity. Do you follow me? Which of these neurotransmitters will be quote-unquote better? Epinephrine or norepinephrine? No, what I'm saying is increased physical activity. Greater effects on the heart, better for exercise, right? No constriction of blood vessels in the muscle, which is good because the blood flow to the muscles will be greater. And high metabolic effect means a lot of energy. So epinephrine is better, okay? Here's the thing. People produce slightly different ratios of epinephrine versus norepinephrine from adrenal medulla. Here's the historical anecdote. In ancient Rome, the selection of recruits for the army was done in a very interesting way. People who were about to become recruits, they were lined up, and there were Roman analogs of drill sergeants, like these really big, scary guys. They just went in front of recruits and insulted them, well, verbally. But they were good at it. They were good at verbal insults, okay? And then there were people who actually did recruiting, and they looked at the reaction of those future legionnaires. The ones that turned more pale, which would be the major effect of norepinephrine, were not selected. The one that turned more red, which would be effect of epinephrine, were selected. People who produced more epinephrine in response to the actual threat were better because they would have higher cardiac activity, higher metabolic rate, and better blood flow to the muscles. Of course, Romans didn't know nothing about it, okay? They had no idea, but they noticed that people who responded with being bright red to the insult were better in the battle, like physically better. And now we have an explanation. They produced more epinephrine. That makes sense. Just a cute story. Unique features. First, one of my favorites. Interaction between sympathetic and parasympathetic system. Reproduction. So, in reproductive function, when parasympathetic system is activated, blood vessels that go to the penis or to the clitoris dilate. And that leads to the blood flow to the penis or the clitoris, engorgement of either, and erection in the male, or clitoris erection in the female. Okay? At the same time, sympathetic system is getting activated also. This causes the contraction of smooth muscles. Smooth muscles that surround ejaculatory duct and urethra of the male ejaculate the semen, okay? Smooth muscles that are in the walls of vagina lead to the vaginal contractions, which help to propel semen back into through the uterus into the fallopian tubes. So that's a great example when two systems get activated at the same time. Does that make sense? I just love how it works together. Unique features that we talked about, heat response. Okay, sweating. It's uniquely sympathetic. Renin release, which I don't have here in the picture, but we'll talk about it again. Increased blood pressure and increased metabolic effects. Okay? So sympathetic tone will increase lipolysis. Now, parasympathetic effects. We talked about it. Short-lived, local. ACH is quickly removed from the synaptic cleft, and parasympathetic system is not branched. Does that make sense? Sympathetic effects are diffuse, systemic, because norepinephrine reuptake takes time, and there's norepinephrine and epinephrine in the blood. Understand that difference, please. And again, I highlight the unique features of sympathetic system that parasympathetic doesn't have. Okay? Control, hypothalamus. Chief controller of autonomic function. Anterior part is parasympathetic, posterior sympathetic. Okay? Hypothalamus relays the effects via parts of reticular formation such as medulla. Okay? Medulla controls most of the visceral functions. Midbrain, which is higher, controls the functions of the eyes, dilation or constriction of pupil and the shape of lens. spinal cord, some effects on the thoracic and abdominal organs, also activities like defecation and micturition. Okay. Now, think about this. Your autonomic nervous system is wired with limbic system. When you are scared, genuinely scared, which is a function of limbic system, the perception of emotion, what is your response? Elevated heart rate, right? Some people pee themselves, which is actually a protective response. Seriously, it's a protective response. What do you mean? Relaxation of the muscles of the ureter and urethra. Okay, that's initial response. No, seriously, it's a protective response. That's one thing. Another, in some animals consider it as a threat. If you ever picked up the turtle, the first rule of picking up the turtle is to hold it like this, away from you. You learn it from the first encounter, after you change the clothes, huh? Yeah, yeah.
There's a turtle. I don't know if it's true, but supposedly it will pee itself to death.
I doubt it. It's really hard. I mean, unless you're peeing like sulfuric acid, I cannot imagine how it can pee itself to death. Seriously. So that's links to the emotions. Okay. When you're happy, you're going to have the same sort of excitement. There are multiple examples of people, bless you, multiple examples, not like thousands, but there are a few players, sport athletes that died of the heart attack after scoring the winning goal because they had stimulation of sympathetic branch because of that excitement, and they had like vessel rupturing or something. Okay, that there were examples of people dying on the field. Now, sometimes you can sort of stimulate the response without any actual input. I can still vividly remember my one and only for the rest of my life experience on the roller coaster. So I still can get scared, without, I don't need to go back to that thing, okay? So you can relive those memories. When you think about food, you stimulate parasympathetic response. Especially when you're really hungry, you think about something savory, you start salivating, although no stimuli other than those in your head are present. Now, that connection via the conscious perception of your emotions enables us to provide sort of a treatment to autonomic diseases called biofeedback. So what is done? You have a patient, okay, whose biological parameters are being monitored: heart rate, blood pressure, respiratory rate. And this patient is aware of those parameters. So you can sit in a chair, look at the computer monitor, and see changes in your blood pressure. Does that make sense so far? And when you see blood pressure getting up, you try to calm down. Consciously calm down. Try to relax. And you see blood pressure going down, and that becomes wired into your cerebral cortex. Sort of So the patient becomes aware of the patient's own parameters, physiological parameters. Blood pressure goes up, the patient sees the blood pressure going up, tries to calm down, relax, maybe meditate. And patient is aware of blood pressure going down. So it sort of forms a very complex reflex. Does that make sense? The only problem with that technique, it takes an awful lot of time and it's pretty expensive. The patient has to spend a lot of time in the clinic. But it, somewhat works. Now, there are diseases of autonomic nervous system. We're going to talk about hypertension as acquired disease of ANS. Imagine that you have constant stress. Okay? Constant stress means elevated heart rate and vasoconstriction, which means elevated blood pressure. Does that make sense? And then cardiovascular system responses chip in. Elevate the blood pressure, exerts more pressure on the blood vessel walls. Blood vessel walls start to remodel and they become inflamed. When they remodel, they become thicker. That's the normal response, you know. Blood pressure goes up, you want thicker walls. Thicker walls mean smaller lumen. Not just smaller lumen, they become thicker at the expense of the lumen of the vessel. Smaller lumen, even more elevated blood pressure. On this side, since you have inflammation, growth and inflammation, you have increased adhesion of white blood cells, increased risk of thrombus, eventually stroke or heart attack. Stay calm. That make sense? Sort of a self-sustained process. Now, genetic disease is Raynaud's disease. It's a vasoconstriction in response usually to the cold. If you have taken 1200 here at Lakeland, there's one professor who has this condition. She always dresses up warm to not provoke it in the class. Sometimes those rooms on the main campus, it looks like they designed it to keep corpses from rotting. Yeah, it's freezing. So, and the extent to which it can go can be fairly mild. You know, it's kind of uncomfortable. Blood flow decreases to the limbs, to being this blue, this cyanotic. In this case, severe ischemia of the peripheral tissues may cause the necrosis of tissues, gangrene, and amputation. So there are treatments, right? Vasodilators, okay? But in severe cases, the rejection of fibers, sympathetic fibers that innervate blood vessels of the limbs is warranted. That makes sense? There's another condition, very interesting one, that's associated with a spinal cord injury. It's called autonomic dysreflexia. The mechanism of this condition is not clear. Okay? So usually it's an injury above the thoracic vertebrae number 6. There is a pain in the area of the skin above that, or there is a bothering sensory stimulus from visceral organ, like bladder that contains too much urine. It may turn two different types of responses, below and up. Okay, below injury level there's vasoconstriction. Above, vasodilation, massive vasodilation, sweating, dilated veins. It may lead to damage to the brain due to the elevated blood flow to the brain. One of our family friends from Louisiana, he had a spinal cord injury in the cervical region, and for him, stimulus for autonomic dysreflexia was cold. So of course in Louisiana we had an apartment complex, we had a pool, and he never went to the pool like in the spring because it was still a little bit too cold. So he needed the temperature to be around like 85, water temperature, closer to the body temperature. Because if it was at certain threshold, if we would go there, he would immediately have this problem. Being vasoconstricted below the level of injury and being severely vasodilated above. And he was very aware of that. But the mechanism of autonomic dysreflexia, we don't know about it. Okay? Let's take a break.